So why would we even consider functional medicine? Well, we may need a revised approach in how we treat these complex chronic diseases. Right now, for every dollar spent in North America, 78 cents goes towards chronic disease. Yet the burden of chronic disease continues to rise. What we'd like to see in functional medicine, it helps us identify the mechanisms on how these patients get sick. And why are these patients so sick? So here's another article from JAMA 2005. Talks about there's a large gap between what physicians do for patients with chronic disease and what should be done. I think if we start to apply medicines that help patients feel better, along with medicines that help treat the underlying mechanisms or dysfunctions, then we can help restore these patients' health. And that's what it's all about. No one form of medicine has all of the answers when we're dealing with something like this. The New England Journal of Medicine. What does this say about our present state of health? Why are we witnessing the forecast of a decline in life expectancy in the next generation in the face of being the most medicated society the world has ever seen? What has occurred? This isn't because we don't have an awesome, phenomenal quality emergency care system. It's the changes that have occurred to our diet, lifestyle, and environment. We know that this is a large majority why this epidemic of chronic disease continues to rise. And unless we start asking the questions, why are these patients so sick, we will never beat this rising tide of chronic disease. Functional medicine allows us to identify the why. So the network concept reveals a number of surprising connections amongst diseases, forcing us to rethink the way in which we classify and separate them. So is diabetes mutually exclusive from arthritis? Well, the answer is absolutely not. We know that insulin resistance can contribute to inflammation through adipocytokine release. Even though we diagnose these things as separate entities or separate problems, the underlying dysfunctions may be similar. So what is functional medicine? Functional medicine should not be viewed as alternative medicine, but as a bridge to a more effective chronic care model. Functional medicine is a framework. It's a framework that bridges all forms of medicine into one common language. It's a science-based systems biology approach that utilizes emerging concepts in genomics, toxicology, biochemistry, and physiology, and helps us personalize our medicine and identify alterations in physiology that are contributing to the final pathology. Where's the root cause of illness? Why do these patients get sick? Is it genetic? Well, many experts now agree that between 5 and 20% of chronic disease is purely genetic flaw, and 80 to 95% of this is the gene-environment interaction. So we see this web-like interaction of physiological factors, and we tend to take very big, extensive cases to find out, okay, where does this patient, what are their dysfunctions, what are their roads that have led up to the final pathology? Over time, if the damage outweighs the support, it's only a matter of time until you get sick. We don't wake up with diabetes. We don't wake up with fibromyalgia. These are the fundamental pathways that contribute to that pathology. So treatment, is there a more effective way? And I think integrative strategies help us pave the way to a more comprehensive integrative approach to helping these patients get well.